You and Nina Turner and other chair people of the Bernie Sanders campaign, you've all said that you oppose not including Medicare for all, right? You've come out for including it. This is purely symbolic. And what do you hope to achieve with that?
Well, first, I want to salute the hundreds of delegates who are saying they can't support a platform that doesn't have Medicare for all. They are historically correct. Our platform had Medicare for all in 1972. It had it in 1976. It was stripped, and this is the important thing, it was stripped from the platform under the Reagan Revolution. People should read the 72 platform, the 76 platform, and then the 1980 platform where it suddenly disappears. All we're saying is let's restore the platform to what FDR and Truman wanted. And I am in full solidarity with those hundreds of delegates. And it's going to be a difficult decision to vote for a platform without Medicare for all in this pandemic.
So what happens if it's voted for or voted against? Is there any leverage?
Well, we're still hoping that the Biden campaign and others would realize that having in the platform a Medicare for all is the aspiration of this party. It doesn't have to, by the way, commit Biden. I mean, he's a candidate and he can have his own view. And I understand we had a primary. Unfortunately, we came on the short end of the stick. And so Biden says, look, I ran on this and I want to keep my view. That's fine. But what we ought to say is that the Democratic Party, the party, stands for Medicare for all. In fact, we moved backwards. I mean, last time the party said we were going to have it till Medicare expanded to 55, and now it's just 60. So in the height of a healthcare crisis, in a pandemic, I can understand why people want to make it clear that our party shouldn't be for people losing healthcare when they lose their jobs.
Yeah, it's really criminal. I mean, you're the jurist, but I don't know. Technically, it isn't. It's morally obscene, though. It's like a death sentence.
It means bankruptcy, it means illness, it means sickness. And by the way, this is now not just affecting working class folks. You know, I represent Silicon Valley, which has huge income disparity, but even middle class professionals, some tech professionals, others who've been laid off or lost their job, they're now having to navigate this crazy private insurance system. And they're saying, I wish we just had a national health insurance. So this is something that I think is so popular, having Medicare for everyone. It is something that is speaking to the needs of millions now, not just those who were left behind, but even the middle class, even the upper middle class. I don't understand why politically we wouldn't be for it. It seems the simplest thing to be for. And Jimmy Carter in '76 won on it. Harris Wofford won Pennsylvania on it. Some of the cultural issues actually are tougher, and we could get into the ridiculous smears on Karen Bass, but Medicare for all is something that cuts across geography, race, gender. I mean, it's a winning message for our party. That's what I find so frustrating.
So what do you think it is? What is stopping the DNC and the other delegates from embracing this very popular program? That's not just the right thing to do, but it's politically viable.
The insurance industry, the pharmaceutical industry, the fear of them, the fear that they're going to spend a lot of money against us on television, the fear of those lobbies, I think, is really what is preventing the reform. I mean, the idea that this is going to somehow take away what people have is just not true. I mean, I've never met a senior who says, I was forced onto Medicare. I mean, you took away my choice by putting me on Medicare. And as you know, the bills all allow for supplemental coverage. And so people say, well, it would be redundant. Well, the point is, see what you get with Medicare. If you don't trust us that the Medicare is going to be great, you have the option of getting anything that Medicare doesn't cover. So there's nothing different. What we're saying is every American should have the chance that seniors have. And by the way, for seniors, what we're saying is we're going to make it better, because now you're going to get your vision covered, you're going to get dental covered, you're going to get long-term care covered. And for employers, they should be for this because their healthcare premiums are going up. It's basically a rent that we're paying to insurance executives and pharma executives. So I mean, it's just pure politics of these special interest lobbies. And if you don't believe me, you should read Debts of Despair, this brilliant book by Deaton and Case. One of them won the Nobel Prize in economics, and they show how white working class Americans' life expectancy is going down. And one of the big reasons they cite for that is healthcare costs. And they say that it's irrational, the system we have from an economic perspective.
Yeah. Were you surprised by this? Did you expect this? Did you kind of know this going in, that this would be a fight?
I guess I was a little surprised that you wouldn't just have Medicare for all on the platform. I mean, I understand, again, I'm not surprised that Joe Biden isn't running on that. Elections happen and one side wins, one side loses, and we came up on the short end of the stick. I get that. But to not have it in the party platform, I don't understand that. I get. I mean, the party pass platform is an aspirational vision of what our party stands for. And if Biden wants to take the view that this is too much change in this particular context, he can run on that, but he shouldn't limit the aspirations of the Democratic Party of what we think is just, what we think is fair, what we platform is our vision of an ideal society.
Right. And also, now is such a great, terrible time, but such a great time to make the argument for it. Because one of the things that's amazing about, or so important about what we're dealing with, is like communicable diseases are actually a really important metaphor, I think, an example of how we're not just individuals. Even if you don't care about other people, you probably want to stop the spread of a disease that's easily communicated.
Absolutely. I mean, this is something we're only as safe as the least insured among us. I mean, we want to have people have basic health care. And this is a crisis. It's exposed the vulnerabilities of the private insurance system. This is the time for bold reform. And that's usually when America faces crisis. That's when we usually shine. That's when we say, okay, we're going to change things. After the Great Depression, we had Social Security. We had reforms in banking. After Kennedy and King's assassinations, that led to change in this country. But I guess right now we have this crisis, and we're not meeting the moment. We're not meeting the moment in terms of a healthcare crisis. Should be a fundamental re-examination of our healthcare system. By the way, if we had a national health insurance, we also would be able to make it much easier to get masks. I mean, Bernie Sanders and I have just had this masks for all bill. But if we had national health insurance, that could be easily distributed. We would be able to get information out about the pandemic. It would be an easier way to coordinate a national response.
And what's the status with the masks for all?
Well, we're hopeful. It's gotten broad support among the caucus, and I hope it would be part of the negotiations in the stimulus bill to make sure people are getting masks. I mean, if you're asking, Amazon isn't providing them, the big companies aren't providing them, and so the federal government, the least we can do is provide masks for people who are doing the essential work.
And yeah, that seems like a no-brainer, and would be very easy to make the case for. And it would be hard for Trump, I think, and Republicans. I mean, they're so good at this, making immoral arguments that somehow appeal to people. But that's a pretty bad look, opposing giving people masks.
Yeah, especially because you're not making it mandatory. You're just saying, here, we're giving it to you. We're giving you the information. Now, if you don't want to use it, I think that's irresponsible. But how can Republicans say that giving people something that's going to keep our community safe is bad? It's the irony. There's one time, Trump, even though I totally disagree with him, a lot of times you get on a purely selfish reason why he's doing things. I really don't get why his response to coronavirus totally inept. I mean, it's in his interest, if he seeks re-election, for those numbers to come down. It's in his interest for us to control the virus so the economy opens. And I think finally he grudgingly started to realize this. But for months, his ineptitude has led us to a place where schools now can't open. Schools would have been able to open had Donald Trump followed more rational policies in March.